Hello everyone, I'm Urologist Erdem Akkaya. Today we will talk about PCT, what PCT is, how long it should be used, and whether it is necessary to use it. There are many questions about this. Is it necessary to do it? What happens if you don't do it? How long will it take to recover? Friends, anabolic steroids are synthetic testosterone derivative drugs, as you know. When you take them into your body, it disrupts the functioning of hormones that control each other, hormones that rotate on the axis of the pituitary, hypothalamus, and testosterone. It disrupts their feedback mechanisms because you take testosterone from outside. After quitting, these hormones come back to their normal state and normalize on their own very quickly in some people, but not in others, even after months. This is where the problem comes from. If you don't get back to normal when you quit, your testosterone level stays low for months, causing loss of sex drive, erectile dysfunction, decreased energy, decreased muscles, increased fat, and a lot of other problems. Sometimes these affect the person psychologically so much that they can actually experience traumas that last for years. How should PCT be here? So there is no consensus in the medical world about this, friends. If you look at Anabolic 11, it says you'll use clomiphene, 10,000 units of HCG and then tamoxifen for 1 month, and then after 1 month you'll look at your values. But there is something like this, friends. Now it is a little more difficult to have a blood test abroad, especially in America. But actually, blood tests will give you the answers about whether you need to do PCT or how long you need to do PCT, and how long it will take to return to normal. With blood tests, you will see that maybe you don't need it. Maybe you have too much estrogen. Maybe your prolactin is too much. That's why, for example, sometimes very wrong applications can come to me. For example, a patient came to me the other day. He used Arimidex morning and evening during the PCT period. When we look at the values, the estrogen is very low. Or someone else came in and said, I have estrogen complaints and I started using Dostinex. I use Dostinex every 3 days. This time, prolactin is decreased. Of course, decreasing prolactin can improve estrogen complaints a little bit and therefore he thinks he is cured, but decreasing it too much can increase the side effects of these drugs. This time, loss of sex drive or other complaints may occur due to this. You know, it is used very uncontrolled, friends, frankly. As I said here, the answer I will give is blood tests. Because with blood tests, you can very easily give answers to where you are going, and where you should stop. Some patients come in, for example, a 45-year-old male patient came in the other day. He had been off steroids for a month. We did his tests. LH, FSH, testosterone, and estrogen all normalized within a month. This person, for example, does not need to use any medication to normalize himself, to do PCT or anything like that. But about a year ago another patient came in. It had been 6 months to a year since he stopped steroids. His testosterone, LH, FSH levels were still very low. And in the process after stopping the steroids, the person was psychologically shattered. He had lost everything he had gained physically. It is necessary to proceed in a controlled manner here. At the same time, you need to protect yourself from the side effects of these medications while you are doing PCT. Also, you can normalize yourself a little bit by taking other supplements during this period. There are 2 perspectives on PCT. One is to detoxify and train the body of these hard bodybuilders to prepare themselves for the next anabolic cycle. Here it's about preparing their body for the toxic substances that will be taken in the next cycle and getting to the next level. And then there is my point of view. My point of view is to normalize the person. That is, to make the person independent of steroids and normalize them. Because when you start these steroids, if you use them for a long time, it's really hard to quit. So when the body gets used to these high testosterone levels, it's really hard to get used to normal testosterone levels again. These people usually continue to use testosterone for the rest of their lives. That is, as long as they don't have any serious side effects such as venous thrombosis or heart failure or renal failure, they continue to take testosterone. Or they make small cures for themselves from time to time. But as I said, after using these drugs for a long time, it is very difficult to stop psychologically, and it is very difficult to stop and become normal and live a normal life. What am I saying this according to? I'm saying this according to studies done abroad, because not everyone can buy them because they are a bit more expensive in our country. But in the US alone, last year's studies identified around 5 to 6 million anabolic steroid addicts. So it is not a small number. 5 or 6 million people are using many anabolic steroids other than testosterone, and they are using them for 10 years, for decades. If we talk about the basic skeleton of PCT, the basic skeleton of PCT is clomiphene citrate. It must be used. Other substances other than that, as we say, consist of HCG, aromatase inhibitors, and drugs used to lower prolactin if it is high. This is the general perception and treatment of PCT. Apart from that, of course, if there are problems with the liver, kidney tests, urine test, blood pressure or other organs, these need to be recovered and corrected. I think the most important approach is the psychological approach, giving the person hope that they can become independent of anabolic steroids and normalize their life. These are also very important. While there is no serious problem in those who use steroids for a short period of time, I can say that it is really very difficult to normalize those who use steroids for a very long time. In general, this is how it is. Thank you for listening, best regards.